Good evening, everyone. Today we are going to see block 2, that is health insurance products and administration. In this, we have unit 4 that talks about packages, designing and pricing. So in detail, we are going to see what is this packages, designing and pricing. So coming here in health industry, this is health insurance industry. Still, it is not seen as a financial instrument, right? It is already we discussed about this. And mainly, is it important? The designing of the health insurance products, is it important? Yes, it is very, very important. And it also plays a key role to create plans that provides coverage, the medical expenses of the policy holder, which all includes like hospital stay of the patient, the doctor visits like consultation fees or consultation amount, and the prescription drugs. What is this prescription drugs? The uh, treatment cost or the medication cost that is being prescribed by the doctor to a patient, and a preventive care is always involved in it. And there are certain key aspects that includes in this process is like coverage levels, premiums, deductibles, co-payments, network options. All these are very important to be kept in mind during the design of the health insurance. And here, like this is being focused like in two ways. Like if you see this focus, why this health insurance is mainly focusing, because so that it should be focused on using the health insurance to improve the use of the healthcare, okay, mainly to benefit or to provide healthcare for the household people and to protect their health of the family or the people around in a society. And mainly this is like help the people from this health expenditure if you have proper health insurance. And the other focus is mainly is processing is very important, like in designing and implementation of the health insurance plans and products. So what is this? Designing is not only important, right? Along with designing, implementation also is important. Planning is important. At the same time, implementation is also important to have a proper goal or to have a proper outcome or an evaluation. And coming to this product, we are talking about a product. So what is this product talking about? So what is this product? It is nothing but, okay, what does it mean is which covers the medical and surgical expenses, okay, medical and surgical expenses of the policy holder when the patient is under treatment. It may be medical or it may be surgical, and it also pays the expenses occurred during the illness of the patient, injury or any accidents of the patient. And here this insurance policies is providing like with the insurance companies, okay, in different ways of insurance, which we already have seen in types of insurance. For example, like life insurance, motor insurance and health insurance, etc. As we have the other insurance types of insurances. And here we have certain elements, okay, coming here to this, we have certain basic elements that are required to develop the insurance health insurance program. Main first thing is smooth functioning. Yes, in order to have a proper elements or to develop a proper health insurance program, first what is important? Smooth functioning is very, very important. Okay, how does we acquire the smooth functioning? With coordination. Yes, there should be a good coordination between whom? Between the insurance company and between the hospitals and also between the policy holders. These three people should have proper coordination, a very good coordination. So that what happens is when you have this proper coordination, the policy holder pays the premium. To whom he will pay? To the company for whom which he is being selected. And next, this company, what they do is where they will return this payment, right? Whatever the premiums you are paying, they will in return pay back to the providers, that is to the hospitals, mainly for the service they have been rendered, that is for the treatment they have been taken. And these hospitals have to be very effective, yes, in providing the treatment for the patients, okay, whatever the treatment they have given to the policy holder, it should be required treatment and it should be an effective treatment for the patient. This entire process, whatever we discussed till now, the smooth functioning, the payment in return, etc., the treatment of the patient, for this entire process and for this entire functioning, what is important? Supervision is important, monitoring is important, and evaluation is important. So now who is going to see the supervision, monitoring, evaluation and all? There already we discussed, right? What is that? Administration and the regulatory bodies. What is this administration and regulator bodies? It is nothing but IRDA. This IRDA is going to see the entire process of functioning, that is for this supervision and monitoring of this process. And next here, for this designing of this health insurance, we need to follow certain elements, and we should have to follow certain principles. So first in that, if you see here, sorry, we have risk pooling. So what is this risk pooling? Risk pooling is nothing but it is a process of a risk management technique. What is it? It is a risk management technique where this insurance company is usually practicing about it. Okay, it will usually practice. It is into practice when there is a risk management. Okay, the name itself is telling you risk management technique. So this technique is used in the risk process of the insurance company, and it is also called as like grouping together. So mainly what they do is the policy holder pays the premium to a pool. So what does that means? When it is paying the premium into a group, this is compensated, this is divided, or this is compensated when there is a loss in the company, when there is a loss in the company. So here what happens when multiple individuals, you, I, the other person, yes, when we all pay the premiums to the insurance company, what they do is they combine all these resources to reduce the overall risk when there is a risk for the large group of people. It may be for the policyholders or it may be for the insurance. Okay. And is it benefit? Now if we talk about this risk pooling, because we are paying the premiums, and what is happening, it has been compensated. Yes, it is important, and this risk pooling is important and recommended because this will provide protection against the financial impact, or you talk about when there is a risk, it will help us against it protects us, it protect us. Okay. And when talking about the empowerment, and next you have a point here called empowerment. So what is this empowerment? Mainly, if you talk about this, this involves providing the policyholders with knowledge. Yes, you have to provide knowledge, and control should be there. Okay, there should be a proper control to inform proper decision, or to take proper decisions about the coverage and claims. When you provide proper information, when the company is providing proper information, only the policyholder can take a proper decision whether he want that proper coverage, or whether when he can claim or when to claim, etc. And there should be a transparent communication. Yes, in empowerment, what should happen? There should be a transparent communication, clear cut information should be delivered, and there should be a good bonding contract between the insurance company as well as the policy holder and the care provider, that is the hospital. And proper information should be delivered for the people who are, like example, if you talk about policy holders. Okay. And here mainly what happens, and next one is equity. So what is this equity now? Mainly, if you talk about, there should be fair treatment to all the policy holders, right? There should be a clear treatment to all the policy holders in spite of their demography or the geography from where they are coming. Okay. And what is the color of your policy holder, religion, race, nothing you have to see. Everything should be fair enough. The value of the policy holder should be fair enough. Whatever the payments you are paying, okay, the premiums that is paid, everything that is should be valued. Okay. Equity, there should be a equity distribution in spite of their color, race, religion, etc. And next one, if you see, there is a solidarity. So what is the solidarity? It is nothing but here, if you talk about, it is like a social insurance, where here what happens is there will be both the rights and the obligation coverage. So what will be here? The both will be including, the rights will be including in it, and the obligations going to be including the coverage and the contributions that are acquired by a policy holder. Mainly, there should be a mutual understanding. Okay, in the solidarity, in the social insurance, there should be a mutual support, there should be a mutual understanding. Okay, where between the individuals. Okay, mainly this also, if you talk about this solidarity also, there should be good individual pooling, mainly to provide this financial protection where there is a need of a company or etc. And here, if you see again, you have 8 design elements. Okay, you have design elements over here. We have discussed about empowerment, equity, and solidarity. And now here you have this 8 elements. So in this 8 elements, first we will talk about this feasibility of insurance design. So what is this feasibility of this insurance design here? Mainly this will access the planning of a design. Yes, you should have, before you design this health insurance, you should, what happens with this when you do this, we can analyze. Yes, if you are having the feasibility of an insurance designing, when you have having this proper designing, this will help us for this proper planning. It will help us to understand or analyze the risk, the limitations, and the opportunities. And the next one is financing mechanism. So what is this financing mechanism? Here mainly what it includes is like risk. If you take the transfer, the pooling, which we discussed, the risk pooling, this all comes under like a contract. Okay, whereas this will be transferred. Okay, mainly what happens, it this is the system. Financial mechanism is what it is, like a system where through which the premiums are collected, risks are assisted, and the claims are paid out. It is like a process of the financial mechanism. What we do, we will collect the premiums, and after we collect the premiums, we have to assess for the risk, whether the person or the policy holder is really in a risk or he is really in a need of the money. So what are the risk and all? And next what happens is, after you assess all this, we can claim the, or we can return the money to the healthcare providers. Okay, so that is financing mechanism, a system of the health insurance company. Okay, and next one is population coverage. So what is this population coverage? Is nothing but it is like a sharing of the population eligibility for the sets of health and coverage. What is like, if you talk about in an example, mainly it will help us to aim to ensure to know that all the individuals have the necessary access for the medical care without facing any financial hardship. The name itself is telling population coverage. All are covered for their necessary medical care. When you do proper coverage, when you take a proper coverage, when you take proper, when you pay proper premiums and all, what happens is you will have a proper population coverage. So here what happens is we can share the population eligibility for the set of health coverages. And next one is the benefit package. What is this benefit package? If you see here, you have a benefit package. This benefit package, the design of the product should have certain benefits, right? Always when you design a project, when you design a product, what should be there? There should be certain benefit. So what is that benefit for the policy holders? Like if you take the comprehensive benefit should be there for their packages that they take. That is the, it may be a health insurance, the LIC instrument, the packages they receive. Okay, and the hospital expenses and the hospital coverage. Yes, there should be some benefit, right? So always when you are designing a health insurance package, you should provide certain benefit for the policy holder. And next one is the provider engagement. So what is this provider engagement? Mainly here, when we talk about this provider engagement, it happens when you have a good, when you provide good patient care for the patient, when you provide low cost premiums for your patient and proper patient safety. Yes, when you give proper patient safety for the patient. So this is creating a bond. Yes, what is this good patient care? Yes, this is like a strategy mainly when you are used to create, or if you want to stabilize the contract between the physicians and the healthcare level organization. So what happens when a provider, now who is the provider here? Your hospital is your provider, and the your physicians are the providers. So always there should be a good patient care. When you can go and consult a doctor twice or thrice, when you get attracted with the treatment, or when you think that the doctor or the treatment is being benefited for you, right? So immediately what happens, there starts a good patient care. So obviously when you have such thing, you immediately go and engage the provider again for the next time. Yes, and when the patient, when the hospital organization or healthcare level, or the physician is seeing the patient safety. Patient safety is also very, very important. And next one is organizational structure. Now, what is this organizational structure? Mainly in health insurance, if you see, like companies have organized, okay, they will have organized departments. Now, if you see in this organizational structure of this uh, designing of this health insurance, you have 5 departments. How many departments? 5 departments. So these departments will be like claiming, financing, legal, marketing, and underwriting. Okay, so these are all are included in this 5 departments. So when we talk about this underwriting, so here you got a name or you have got a term that is called underwriting. This is very, very important to know about. Okay, so what is this underwriting is nothing but mainly this insurance companies will evaluate the insurance application, the one who is applied for the insurance to pay a premium. So what they do is they evaluate the insurance application and they will decide whether we can approve it or whether we have to reject it. That is the underwriting we will see in detail. And next one is operational processor. So what is this operational processor? Here, mainly when we talk about this operational processor, this includes it is important, right? Operational processor is important for the smooth functioning of the insurance company to see whether the policy holder has received the proper needed services that the insurance company is being providing for the policy holder. So this all includes in this what design is included, like framing the functioning and executing the business strategy and formulating the accounts, what is being paid by the patient and all is being included. For example, we have certain examples of this operational processor like premiums collection, claims, underwriting, risk assessment, monitoring. Okay, this risk assessment. And next one is what? Monitoring and evaluation. Now we have talked everything, right? Like you have around all these designs. What happens is mainly monitoring and evaluation is very, very important. Already we discussed, right? Who is going to monitor and who is going to evaluate. Now, who is going to monitor and evaluate? The regulatory bodies. That is, IRDA is going to monitor and evaluate all the elements, the designing, whatever till now we have been discussed. And next one is we will talk about financial uh, financial resources. Okay, we will talk about financial resources. So what is this financial resources if we see? Okay, who will generate this financial resources? Okay, in many industries, countries, okay, here we talk, okay, great value on equal access to the healthcare by the individual. So mostly they will like coverage all of the people in a certain amount, like it includes their technology procedures. Yes, the procedures nowadays that is being given in the hospital, the treatment that is being given in the hospital is completely technology based. Okay, may not be ready available for all the people, not for all the hospitals. Okay, not all the people can also render this technology procedures or technology treatments that is being given in this private or the corporate hospital. If the patient is having, if the policy holder is having a good well insurance, health insurance, is well enough to claim all these things. So what happens? The policy holder can go with the technology procedures and the treatment. But if the person who is not having proper this health insurance packages, obviously they cannot go for such expensive treatments. Okay, they are well less accessible people for such type of things. Yes. So now who will generate this financial resources in the insurance? Nothing but funds. Yes, you will collect funds by the premium. These funds are mainly invested in out securities or like stock markets, etc. And here, one more thing that we can talk about is, so these funds, these assets, and these are the assets. Funds are what? These are the assets or for the financial organizational activities. Yes. And coming to this uh, financial resources, mainly if we take one example, that is industrial countries. In an industrial countries plays a great role, right? They play a main role in valuing of the health access or equal access to the healthcare people. So mainly as till now, whatever we discussed, okay, like these countries, what they do is they will provide a basic universal coverage to all the people, okay, according to the technology, the procedures of the treatment. Okay, so those who don't have medical insurance, what happens? They find expensive. Okay, they go for a less treatment, or they will go for the treatment to such hospitals where they can pay the less amount. Okay, either they may, for example, they may walk into a government hospital or okay, public hospital. So in India, if you see healthcare system, like it has a mix of public and private entities. Obviously, right, you have public hospitals, that is your government hospitals, and you have a private corporate hospital. So this is of a choice, right? It is my choice. If I take a good health insurance policy, I will go for what? A private health sector, or I will go for a private entity. I will select a private entity, or I will select a private hospital, or I will go to a corporate hospital for my high technology procedures and a high technology treatment for my health. So what happens? These families who can afford the cost, or who can afford for the uh, uh, whatever the care that is given, okay, according to their cost and expenses. So this quality of care, they go to their private hospitals. Okay, those who don't afford, what they'll do, they will go for the general hospitals, like what is that, government hospitals, like primary health center, or it may be a community health center, area hospitals, etc. So these all comes under the uh, public health organizations, or the public health system. And next, here what happens when there is a private health insurance, when you have a proper when you go in a proper guidance, when you have a proper private health insurance resources, what we talked about, if what happens, you may be affordable, right? You can be affordable to access the quality care that is being given for the policy holder. Okay, and next you have, a topic that is called existence health infrastructure. Now here you have a existence health infrastructure. So what is this existence health infrastructure? It is nothing but, if you talk about, there are so many health infrastructure that is related to the services, the facilities that has been contributing to the population, the society of the health. Now, if you see, there are, which we discussed till now, like I said, primary health centers, community health centers, the allopathy hospital, the hospital beds, the homeopathy, Unani, okay, blood banks, eye banks, mental hospitals. Yes, these all are included in the network of healthcare providers, which we have been already previously discussed. Okay, and this all includes what? Advanced machines, specialist doctors, nurses, and other paramedical professionals, like if you have, and these are developed in the pharmaceutical industry. And here, these are very important factors. Now, what we have discussed now, like hospitals, beds, PHC, CHC, blood banks, eye banks, mental hospital. These are all the important factors in designing of health insurance production, or a health insurance product. Okay, this network we already discussed. It is going to have a public or a private. It may be a public or it may be a private. Okay. And also here we, like already discussed, who all comes under this. They all it also includes like advanced machines. Yes, specialists, doctors, nurses, paramedicals, etc. And again, if we see according to this KPMG, now this KPMG, this Clinwell Peach Marwick Gaudier. This, what happens is, here it is talking, it is a global professional. It is a global professional service network. What is this KPMG? It is a global professional service network, where it is talking about that 80% of all the doctors and 75% dispensaries will serve how much country population? That is only 28%. And as per the National Health Profile in 2019, it has been observed as like how much? 7,13,986 total government hospital beds are available in India. This is according to, like as per this National Health Policy 2019. Okay, what is observed here? 7,13,986 total government hospital beds are available in India. And next, if you talk about quality of care. Okay, and next, if you see here, quality of care. Okay, before going to this quality of care, now as we were talking about this government hospital, total government hospital, what are included in this? The central government hospitals, state government hospitals, local government. You know what is central government. If you take, what is the example of central government? ESI hospital is a central government hospital. State government, if you take Nilofer, what else? Gandhi Hospital, Usmania Hospital, etc. And local government hospitals, like if you take this primary healthcare centers, community healthcare centers, and what else, this area hospitals. Okay, this all comes under the local government hospital. So is it necessary? Now we were talking about all these hospitals, blood banks, eye banks, mental hospital, etc. So yes, this necessary adequate infrastructure is very, very important to have a proper health insurance, for making a proper health insurance designing. And next, coming to this quality of care. You have quality of care. So what is this quality of care? It is nothing but, like, if you see uh, quality of care, if you see, it is nothing but a measurement. Okay, here it is, here you can see quality of care is also a key component for designing health insurance product. Yes, it is plays an important role in designing the health insurance products. Quality of care as per World Health Organization. What does it defining is the extent to which healthcare services provided to the individuals, the patient populations, to improve their desired health outcomes. Yes, already we discussed. Planning is not only important, right? You just sit and plan the care for the patient. Will your patient recover from the illness? No, you have to provide care. Whatever you have been planning for your patient, whatever the services that you have been planning for your patient, you have to implement it, right? You have to implement it on your patient. You have to go and do it on your patient. You have to render the service for your patient, and your patient should receive that service. After the service has been received by the patient, you have to analyze, or you have to check the, or you have to assess the outcome of the patient. What is the outcome? Yes, when you provide a good quality of care for a patient, what happens? What will be the outcome? It will be a good outcome, right? It will be a good outcome. If you don't provide quality of care for your patient, will your patient have a good evaluation, or will your patient have a good outcome? Will your patient disease condition, or the service that you provided for your patient is being benefited? No. The quality of care is very, very important. Mainly, this will measure how well the health services work to provide the desired outcome for your patients. It's nothing but planning, implementation, and evaluation. How you are being implementing, how well you are providing your healthcare services to your patients, and what is the outcome of the planning or your implementation. So for this, you have 6 aims to achieve proper healthcare or quality of care. You should maintain the 6 elements, like safe, effective, timely, efficient, equitable, equitable, and people center. Now, what is this equitable people center? We will see in detail. So first one is what? Providing safety, right? Safe is not providing safety. Mainly, you should avoid harm to the patients during their medical treatment. Yes, when your patient has been admitted in your hospital, you should provide a required and whatever the treatment, whatever that is needed for your patient. Unnecessarily, you should not harm your patient. You should provide safety for your patient in your healthcare sector. And next one is effective. What should be effective here? Mainly, you have to treat the patient, whole patient. That is, you have to provide a proper, effective care for your patient. That is, quality of life is important. You should bring out a desired result. Now, what is your result? What should be your outcome? Your patient should improve, should be your outcome, right? So you have to work out. So you have to work, or you should bring out that desired result working for your patient. So you should not waste your time. You should not waste your energy, right? You should do your smart work. Nowadays, smart work has been effective in all the organizations, right? You should use best available resources, whatever the resources that you are having for your patient, whatever you have to do it for your patient, for his treatment and for his desired health outcome. You should do all the you should use all that available resources, and see that you're not wasting your time and not wasting the time of your patient. So by providing proper quality of care, you can also, you are giving quality of life for your patient. Yes. And next one is what? Timely. So what is this timely? Now, time is important, right? As now we discussed. Okay, we have to reduce waiting time for your patient. This obviously happens in the hospitals, right? What happens here? Most of your patients wait for a longer period of times in the hospital for the treatment and for the doctor appointment. So mainly we have to keep this in mind that we have to maintain proper time. So this time also comes under quality of care. For example, if you take, you are providing proper safety for your patient, you are providing whatever effectively you are planning for your patient for a better outcome for the quality of life, and you are efficient, you are equitably, and you are also people centered. So you are following all this uh, order, but you are not following this time, you are not having proper quality in the time. So what happens, the other things also affect. If your patient want to come to your hospital also to visit the hospital, what does it trigger them? Okay, array, if we go to that hospital, we have to wait for a longer period of time for the appointment. Okay, everything will get delayed. So, chalo, we will go to the other hospital. So, here what is happening? Quality of care is getting disturbed with one element. So, it is important to maintain proper time. We have to reduce the waiting time and the delay time for the appointments, treatment, etc. And next one is efficient. If you see what is this efficient, especially functioning in the best manner with the least waste of time and effort. Already it is interlinked with this effectiveness. And next, coming to your equitable. Okay, always delivering healthcare. It should not differ in the quality of care. Yes, like previously we have seen, no, you should not see the gender of your patient. You should not see what is the race of your patient, whether your patient is white, whether your patient is black. Okay. And no, I will give treatment only for male patients. No, I will provide treatment only for female patient. It is not like that. Okay. You should provide equitable quality of care for all the patients who have been admitted in your hospital. Yes, in a organization. So here you have to provide, okay, in spite of the gender, race, color, etc., socioeconomic status, right? You will not show interest only rendering the care for the patients who are having money, yes, who are rich, and you're just neglecting and not providing quality of care for the poor patients. It should not be like that. Okay, quality of care should be given for everyone in a equitable distribution. And next, coming to the so people center. You have to always keep the people center concept when you are providing this care for your patients. You know, here what happens is this all till now what we have discussed. Okay, whereas this all in an health insurance product, this must be ensured to provide quality of care to the policy holders. Okay, and next one, if you see, we have like pattern of disease. The other one is what? Pattern of disease. So what is this pattern of disease? Is it important to be concerned in our health insurance designing? Yes, it is very, very important to know for the designing of this health insurance product. So what is the study of this disease pattern? It is nothing but you should know the epidemiology of the disease, determinants, occurrence, and distribution. So before going to this, we have to understand how the disease is moving around the environment, around the population, from one animal to the another animal, or from one person to the another person. Yes. So here when you talk about this epidemiology, so what is this epidemiology? It is nothing but study and analysis of a disease condition. Okay, study and analysis of a disease pattern. Determinant is what? Cause. From where this disease is being caused. That is your determinant. Occurrence is what? Evidence. Yes, the event, the incident is your occurrence. And what is this distribution? Distribution is nothing but how the disease is defined in the population, how it is being distribution, how it is being spreading in the population. So this pattern you should have an idea. When you are designing a health insurance, it should have a proper idea, because already we discussed one point. What is that? Pre-existing diseases, because this is important for us in order to know this pattern of disease, mainly because why this pre-existing diseases do not cover in the health insurance policy. Okay, and next you have levels of health insurance. What is that? You have levels of health services. Sorry, you have levels of health services. I think you already know about it. Like you have primary healthcare, secondary healthcare, and the tertiary healthcare. These three healthcares you have. Okay, so here mainly these levels. Okay, mainly these levels are there to provide. Okay, these two all together, they will provide medical services, especially for evaluation, and it will provide treatment based on the need of the patient. Okay, based on the specific need on the patient. For example, it happens, right? If you take a normal family or a person, you take a, yeah, a person from a middle class or whatever it is. So what happens here now? The person, if he is suffering with a fever, he's just suffering with a fever, and the patient is from a just a normal family. So what happens? What do you think? Whether the patient will go, he will go to a primary healthcare, or whether he will go to a secondary healthcare, or whether he will go to a tertiary healthcare, to a multi-speciality hospital, to a corporate hospital. Will he go there? No. He will go to a primary healthcare where he can get a basic treatment in the primary health center. Understood? For his specific needs. So according to the specific needs, these levels of healthcare have been divided. So first, if you see primary healthcare, so this primary healthcare is nothing but it is the first level of the contact where your individual, that is the patient, come in contact. Just as I said you, if a patient is suffering with fever, first he will go to the primary health center that is nearby his home, or etc. Okay, so this where they provide primary health care. They will provide the basic essential care that is needed for the patient. So who will provide care in this primary health center? You have an idea, right? Who will provide the health care? Like if you see multi-purpose health workers, village health guides, ASHA workers, Anganwadi workers. Okay, these all people work under the primary health center. So what levels will come under this? If you see, as I discussed, like primary health center, sub-centers, yes, area hospital, community, sorry, this community levels come under this one. Okay, and this what they are going to do is they will provide the care for the yeah, they will provide care for whom? For the basic needs. Okay, and the next one is secondary healthcare. Now, what is the secondary? Mainly this primary health centers comes under this services. And mainly if you see this primary healthcare will mainly focus on the promotive and preventive. Okay, they provide services to promote the health and to prevent the illness, etc. For example, like if you know, if you see diabetic screening, immunization, okay, diagnosis is done, okay, and immediately they will refer the patient to the hospitals. Okay, and if you see this in the secondary level, it is an intermediate. Okay, it is an intermediate. Mainly what they do is they provide care in a district hospitals. Okay, here they provide care in the district hospital, community hospital, area hospitals, okay, etc. And mainly they will do referral. Okay, they also serve as a referral. If treatment is not available in the primary health center, if the treatment is not available in the secondary health care level, so immediately they will refer the patient to the tertiary health care. Okay, they will yeah, they will refer. If you see, primary healthcare focuses on promotion and prevention. Secondary healthcare will focus on the curative services, as well as tertiary healthcare also. So this tertiary is what? It is a specialized care. Yes, this is a specialized care given to your patients with the specialized doctors, with a specialized team. If you take, or example, if you can take like example, all multi-speciality hospitals come under this. Okay, or you can take this central level institutional, regional hospitals, medical college hospitals. Now, for example, if you take in Hyderabad, Gandhi Hospital, Nilofar Hospital, yes, and Usmania Hospital, this all comes under the tertiary health care. Understood? Yes. And next one, if you see, yeah. Next, if you see, there is like demand. Okay, here is estimated, yeah, estimating maximum demand. Okay, here we talk about mainly the demand for health care is the derived demand from the demand for health, and health care is demanded as a means of consumers to achieve a larger stock of health capital. So mainly what happens is when you're talking about this estimating maximum demand, this is a method of estimating your future. Understood? This is a method, or this is an estimated maximum uh, sorry, method of estimating your future medical demand, whether to take the service or whether to not to go for the service or a healthcare provider. Okay, mainly what happens, this will depend on your affordness. This will depend on your willingness. Yes, if you are willing to pay, you will go for it. If you're not willing to pay, you will not go for it. If you want to go and have a visit of a doctor or a healthcare provider, you will go. It completely depends on your future, estimating your future. So if you just, in simple words, I just want to tell you, estimating maximum demand is nothing but it is a method of estimating your future. What future? Your medical demand. Okay. Mainly here to seek whether you want to have the proper service, whether you can afford the cost, or whether you are willing to pay or not. It completely depends on the consumer. And next here, what happens is individual make choices, right? Individuals, the patients, the policy holder will make their choice about the medical care. Obviously, we all do that. What we do whenever we want to visit a doctor, it completely depends on ourselves. When you are just having a minor condition, like if you just have a fever, simply you don't go, you won't go and consult a doctor, right? Simply will you go and consult a doctor? No, you will not simply go and consult a doctor. Okay. So here what happens is, so mainly this, what I was talking about is, so mainly the policy holder, the individual, the patients have their choice about their medical health. They will decide, okay, when to visit a doctor, when to consult a doctor, when they fall sick. And this what happens to get operated or not. Okay. Whether I should go for operation or not, whether I should undergo for this surgery or not. The doctor is going to explain about the condition of a patient, but this completely depends on the patient decision, right? The finally the decision should be taken by the patient, whether he is willing or not, whether he is having proper concern about his condition or not, and to get immunized for the children or not. Now this, the doctor, you are saying advertisements, okay, like polio vaccine. If you see, yes, what happens, you have lot of advertisement in your FM radios and social media, in your televisions, etc., stating that you have to give this proper vaccination, immunization to your patient. So this awareness is, you're giving awareness for your patient. But finally, what is happening here? Immunization. What is happening? Completely, it is dependent on the decision is being dependent on the parents, whether to go for immunization or not, whether to go for the follow-up checkup or not, is completely depend on your interest. Okay. And this whole process, what happens is, it's making your decisions complicated. If you're taking a fair decision, well and good. Yes. If you're taking a fair decision, it is well and good. But if you're not taking a proper decision, what happens? It is complicated, right? It is making, you are making the things complicated. If, for example, now we were talking about a vaccine, right? What is happening with this vaccine? What is now, if the patient is like, we were talking about, what was that, like vaccination, it completely depends upon the interest of or willingness of the parents. Finally, if they are not understanding the awareness, whatever we are teaching them, that vaccine is important or not, so what happens here, if they are not understanding, if they're not having that awareness, here what happens is the things get complicated. Now who is going to fall in, who is falling into risk? The child is falling into risk. So these decisions are very, very important, and these are all involved with the advisors of the families. Yes, sometimes your families, your friends, your healthcare providers, etc., everyone will give you a what, you can take decisions. Okay, if you have you can take advices, you can take decisions from your family, from your friends, and from your healthcare providers. So this is very, very important in estimating your maximum demand. So this demand of healthcare is affected by certain factors like pricing, incomes, and health status. I already said you this, prices and income. If the prices are more, it is your will and wish whether you have to go or not. But if you are really interested with your health, and you should have the proper insurance, or that you have to go and have a proper healthcare checkup, you have to go for the visit of your doctors. Yes. And next, coming to the pricing of health insurance package. Okay, pricing of health insurance package. So what is this pricing of health insurance package now? Yes, this premiums, mainly what happens, this premiums for the individuals And group health insurance packages are mainly affected by many factors. If you see, okay, we are having certain premiums. Premiums are being paid by the your policy holders, right? Premiums of the individual, the group health insurance packages are affected by many factors such as rates of morbidity because of the disease condition, because of the cost of the drugs, yes, medicines, and cost of the providers, hospitals. Yes, nowadays, if you just visit a hospital with insurance or without insurance, there are a lot of cost or charges that has uh, been given to the people, okay, or to the society or to the public, and payment arrangements. So these all are related. So these are all involved in the premiums. Whereas it is important for us to know that pricing is necessary. It is important for us to estimate the future. Yes, it is important for us to estimate the future. So whereas now, like, yeah, we have seen now diseases. Yes, what was that? Diseases, the drugs, etc., the payments, etc., and all. So mainly what is happening? So this pricing of health insurance is important for us to estimate the future cost, to know about the pricing, whether it will reflect the risk or not, that is involved in it or not. So coming here, we will see what are the factors that are influencing the pricing health insurance policies. Okay, there are certain factors that are influencing the pricing health insurance policy. As we are talking about pricing, it is important for us in this one. Okay, so first one is what? Cost of pharmaceuticals. Here what happens is, this is very important, and also it is very a complicated factor. What happens here is which influence the health insurance pricing, right? Mainly what happens, who will come under this one? For example, if you take in this pharmaceuticals, three central entities are there. Okay, three central entities. Like example, if you take drug manufacturers, pharmacy managers, and insurers. Who? Insurers. Okay, so here comes your drug manufacturers. So what is this drug manufacturers means? Now what is it? You all know what is this drug manufacturer, right? uh, it is like a person who is manufacturing, who is selling, and who is marketing and distributing the prescribed drugs in the pharmacy, right? To a pharmacy or in a pharmacy. Okay, and who is this pharmacy manager? Pharmacy manager is the person who overall oversees all the aspects of the pharmacy operations, like pharmacy staff, okay, staff of the pharmacy, ensuring that the medicines are dispensing correctly or not, what is the expiry date, what is the manufacture date of the drugs, etc., of all, etc. And next is this insurers. Now I said in this pharmaceuticals you have three entities. What are the three entities? Drug manufacturers, pharmacy manager, and the insurer. So what was it? First one was your drug manufacturer. So what is this drug manufacturer? This means like selling, yes, selling the drugs, manufacturing the drugs, marketing and distributing the prescribed drugs to the pharmacies. Okay, next one was your pharmacy manager. Now who is this pharmacy manager? You already know what is the role of a manager. So what they do, they will just see the pharmacy operations, like who are the staff in the pharmacy, how they are functioning, how they are performing, okay, and how they are ensuring the medicines, how they are dispensing, what is the expiry date, what is the manufacture date of the medicines and all. And the next one, last one, are the insurers. Okay, this insurance company. Insurers are nothing but their insurance company that accept risk and promises to the pay. Yes, what do they do? This insurance companies, what do? They will accept the risk and they will promise to pay the claims to the people. And next one, if you see in India, it will cost like 20% of global generic drug markets are there. How much? 20% of global generic pharmaceuticals or this drug markets. Okay, and here when you see, coming to this drugs or drug prices. Now, who are going to charge this drug prices in India? These are directly, okay, these drugs are directly controlled by a thing called drug price control order that is issued by the government, called the you have certain acts for this, like essential commodities. Okay, like essential commodities, government under the essential commodities, and they are going to regulate the prices, and they will effectively monitor and control the cost of the pharmaceuticals, okay, directly, to have a direct impact on the pricing of the healthcare packages. This is very important, right? Because we are like paying the premiums for their cost of pharmaceuticals also. And next comes your consultation. Next comes your consultation. So what is this consultation? You all know, right? Meeting to discuss about your health issues, to get advices by the healthcare providers. You go and consult a doctor, right? When you are in need of a health treatment, or when you are in need of a desired outcome of your condition and all, you just go and consult a doctor. So when you consult your doctor, what does your doctor do? He have to collect your medical history. Okay, how your doctor will just, you all have an experience about it, right? Your doctor is going to like ask you the medical history. The doctor will ask the medical history, and also he will do the physical examination of the patient from head to foot. He is going to do the examination. Or if the patient is having a problem with his GI system, gastrointestinal system, he will do complete and thorough investigation or physical examination of the GI system. Okay, and after that, after collecting the history, after doing certain physical examination of the patient, if the doctor thinks, okay, if a physician thinks that the patient needs investigation, okay, then the patient have to go for the investigation. So this consultation expenses, this will depend upon the hospital, obviously, right? This will depend on the hospital treatment and the doctor. Sometimes you see in certain hospital there is more demand for certain doctors who provide a good care, technological care for the patients. Okay, and this expenses, now if you see in the consultation, it involves inpatient and outpatient expenses, right? Inpatient and outpatient expenses. And next, coming to your diagnostic. In consultation, you have a subtopics called a diagnostic. Now, what is this diagnostics here? Mainly, this is like a process to identify. Okay, this is a process to identify the disease condition according to the signs and symptoms of the patient. Yes, what is this diagnostics here? What we do is we will try to identify what is the disease condition of the patient, okay, according to the signs and symptoms. Now, if the patient is going on complaining that he is having stomach pain in so and so quadrant region, if the patient is having nausea, vomiting, constipation, diarrhea, etc., all these GI symptoms, then what does your doctor suggest? He will suggest to go for an investigation. What is that investigation? Ultrasonography. He may suggest the patient to go for an ultrasonography. So this investigations are done under the process to just to confirm the disease condition, to confirm with what disease the patient is being suffering. And this diagnostic costs are also important in the pricing of this health insurance packages. And next is your supportive services. Now, as the name itself is telling, support service. So what are the support service? These are nothing but the services which are not directly, okay, these services are not directly related to the patient care. For example, if you see, as I said, directly, so these services are involved indirectly, okay, with the patient care. For example, if you see housekeeping department, biomedical engineering, linen department, or a laundry department, dietary department, that is food and beverages, counseling department, etc. The other all supportive services in the hospital. Now, whatever I've listed, like hospital, housekeeping, biomedical, okay, and laundry department, dietary department, counseling department, these are not directly involved in the care of the patient, but these are all the supportive services that are indirectly involved in the care of the patients. And next one is hospitalization. So what is this hospitalization? It is nothing but expenses are very important in the health insurance claim. Yes, when a patient is being hospitalized in the healthcare delivery system. For example, there are two types of expenses in this hospitalization: pre-hospitalization and post-hospitalization. Now, what is this pre-hospitalization here in this? You have pre-hospitalization expenses. When your patient is being hospitalized, you have two types of expenses, that is pre-hospitalization expenses and post-hospitalization expenses. So this pre-hospitalization expenses is like medical cost. Okay, this is the medical costs that are related to the consultation of your medical bills, your diagnostic test, your medication, drugs, etc. that is being prescribed before the admission to your hospital. This is already telling you pre-hospitalization, that is being before admission to the hospital. So your diagnostic test, drugs, that is your medication, your prescribed medications, and for your medical consultation that is being charged by your doctor. And next one is your post-hospitalization expenses. So obviously, post means what? After. So after the policy holder is being, after discharge from the hospital, the expenses of the policy holder after discharge from the hospital comes under the post-hospitalization charges. And next comes your operating cost. What is this operating cost? Now, whatever the ongoing expenses that are there in the normal normal day-to-day running a business. For example, if you see these expenses, now whatever we are talking about, this operating cost, these expenses will depend on the not only this depend on the design of health plan offer. Like example, like payroll is important, sales, pension, employee benefits, transportation, travel, taxes, etc. These all are involved in the operating cost. What is it? Payroll is involved, sales are involved, employee benefits are involved, travel, transportation, etc. Everything, pension, okay? All these are involved in the operating cost. So after knowing all this, like we have seen all these principles and packages, right, that are influencing the pricing health insurance policy. So what happens after? So after knowing all such principles, elements, etc., designing a health insurance product is very, very important for us to consider, right? This is important for us to consider. And when you come here, like this can change. Now, whatever we discuss, this consultation, diagnostic, supportive services, hospitalization, and operating cost, this will differ from one state to another, from one insurance company to the other insurance company, and from one country to the other country. It is not that these all are compulsory, the factors that influence the pricing health insurance policy. This all factors can differ from state to state, country to country, and a company to company. Okay. So this all are about your designing and pricing of the health insurance package.